Welcome back, everybody. March 31st, next Monday, is the deadline to sign up for health insurance through healthcare.gov. And as that deadline looms, the debate about healthcare in this country is raging more fiercely than ever. Today, we start by looking at whether Obamacare is the answer through the lens of its closest precedent. That's the Massachusetts healthcare law known as Romneycare. Here to discuss what lessons can be learned from that precedent and where we go moving forward based on that are former Democratic Massachusetts Congressman Barney Frank and Avik Roy, who is a former healthcare advisor to the Romney presidential campaign. Congressman, I want to start with you. You served in Massachusetts during Governor Romney's statewide healthcare mandate. What do you think we should learn from that experience?
Well, I apologize. I'm not a very good person to ask that. It is true I was serving in the Congress during that time. I was not in the legislature, obviously, and wasn't directly involved. The one thing I can tell you is that I would hear from constituents about this or that problem. During the time since it was signed in whatever 2006, I haven't heard any complaints about it. So at the state level, it worked well. In terms of lessons, I must tell you I'm not sufficiently familiar with it to do that. I obviously voted on and was supportive in general of the Affordable Health Care Act, although parts of it I would have liked to have seen done differently. Even there, I must say, I was spending most of my time at that point on the financial reform bill. So it's probably one of the ones where I'm not as good on the details as I should be.
All right, so that is a general Massachusetts perspective. I'll come back to you on the national question of healthcare. But first, let me ask you, Avik, there are a number of specific differences between Romneycare, which played out beforehand in Massachusetts, and Obamacare. They actually allow you to calculate whether an employee is full-time or part-time in different ways, and you can talk about that. Also, it allows businesses to deduct the Romneycare penalties from their taxes, which is distinct from how Obamacare handles this. And finally, Romneycare penalties are actually much more modest. A number of business owners that I've talked to have therefore praised Romneycare and somewhat dinged Obamacare. Do you think that the Massachusetts precedent was handled better than this national rollout?
Yeah, I think the biggest thing, stepping aside from those technical details you just mentioned, the biggest difference is that Romneycare was a state-based reform and Obamacare was a federal-based reform. And Romneycare really only added the exchanges to the existing architecture of the healthcare system in Massachusetts, whereas Obamacare had to do a lot of much more significant changes to the healthcare system, which are more disruptive and have a lot of people unhappy. And the other thing to mention, of course, is how the exchanges were implemented. The exchange worked relatively smoothly, as Senator Frank or Congressman Frank mentioned. The exchanges, the enrollment started slow, then it picked up, but there weren't the complaints about the technical challenges. What's ironic now is today, in terms of sign-ups for Obamacare, Massachusetts is dead last in the country. They've had a lot of difficulty having the Obamacare website interact with the Romneycare website.
And if Mitt Romney had become president, how do you think the national health care conversation would be playing out differently?
Well, it would, of course, be a lot different because he would be trying to make a lot of changes to the law, both in terms of executive orders and regulations and also in terms of what he would try to get through Congress. But in terms of the basic stuff that would need to be executed to get the law up and running so people weren't so dislocated, I like to think he'd do a better job. I mean, he was very experienced in the private sector at just this sort of thing.
And going back to you, Congressman Frank, you were in office during both Democratic pushes on health care, including that from Senator Kennedy, and also, as I said, Mitt Romney's rollout of that Massachusetts health care plan. Without getting into technical details, what would you like to see happen next in the national conversation about health care?
Well, that's a very important point because I count it as a great advantage that we did this on the national level and not the state level. The single best part of that health care bill, from my standpoint, was the expansion of Medicaid. You talked earlier about the difference in the lifespans. Well, the difference in the lifespan in America is a very different one within America according to people's income and social economic standing. Wealthy Americans do very well. Part of the reason for our lower level is the excessive inequality we have and the problems that causes for people at the lower level. So, and that's something that couldn't have been done at the state level. The expansion of Medicaid, and I've been appalled at some states where they've rejected federal assistance to help people just above the poverty level get into Medicaid. So that's one of the ones that I would approve on. You know, we try to make that mandatory. The U.S. Supreme Court upheld the overall bill, but threw out the mandatory part. I would like to change the law so that that was mandatory. And you know, yes, I care about Massachusetts, but I care about poor people in many of those states who are terribly deprived and who, for sort of partisan reasons, aren't getting any assistance. So I would like to mandate, and we're talking about 90% federal funding.
If I could jump in here. If I could jump in here,
Yes.
one thing I would say is it's far from clear that Medicaid actually solves the problem of life expectancy being lower for poor people. All the literature, the most famous being this Oregon Medicaid experience that was published in the New England Journal of Medicine, showed that Medicaid had no impact on measured health outcomes relative to being uninsured. So there is a problem with inequalities or discrepancies in the life expectancy of low-income people, but it's not clear that Medicaid's actually addressing the problem.
Well,
I don't want to get into
disagree with that
dueling
in terms
studies,
of-
but there is literature that suggests that Medicaid does offer
there's always
important support
literature
there.
on a variety of things. People look. There are people, conservatives, who don't like Medicaid, who would like to cut it way back. I think it is clear that lower-income people are better off with it without it, and I know that was true in parts of the district that I represented. So again, the fact that it has not meant an immediate increase in longevity or within a 5 or 7 year period does not make Medicaid not a good thing. I mean, would you rather not
There are
have Medicaid
alternative
extended
solutions,
to
I'd say.
lower-income people?
Well, we can continue this conversation about the specifics of Medicaid at another time. I think you both raise important points. I thank you, Avik Roy, and thank you, Congressman Frank, for joining us for this. And we hope all of you will continue to respond at home.